Hi, I'm Case Kellahar. Did you know that in some cases you can choose where you die? Today I'm here to inform you about end-of-life care choices. My topic today is going to be on hospice. I'm going to talk to you about what is hospice, the history of hospice, and the utilization of hospice in the United States today. I have had past and current family members on hospice care. This information will help you know your options when you're faced with life decisions about end-of-life choices. So first off, I'm going to start with talking to you about what is hospice. Hospice is a program that helps you die with dignity. It's a program that lets you give the option of where you'd want to die. It really helps people that want to die at home get that chance to go home and get the care that they would receive in the hospital. Hospice isn't a program that's going to fix you. By now, you've accepted that you're going to die. On hospice, they believe in comfort cares, which means you reposition a patient every 2 to 4 hours or as necessary. They also believe in making sure that you're not in any pain in the last few months of your life. So they want to make you as comfortable as possible so that you don't have to remember your last couple of months just being in pain. On hospice, they have bereavement and counseling sessions. They start the minute that your loved one starts hospice. So on their first visit, then you'll set up a session, and they hand out reading materials. They help you cope with your emotions because you're going to be sad and you're going to be angry, and they're going to help you learn ways to cope with that and work around it and realize that this is what's going to happen and it's inevitable. This support for your family will continue after your loved one dies. You will have a couple more sessions with them, and they're always there for you. So hospice really is a thing for you to die at home with dignity and in comfort, and it is a support for your family so that they feel like they have someone there that cares and they know what you're going through. Secondly, I'm talking about the history of hospice. Hospice is a Latin word that comes from hospitium. The word originated meaning described as a place of shelter for lonely and sick travelers. The first hospice movement was set up in the 1960s in London by Dame Cicely. She was a nurse during World War II, so she got to see a lot of sad things during that time, and she wanted people to have a comfortable place to die. She came up with the St. Christopher's Hospice. It's not like a hospital. It's strictly a place that people go that know that they're going to die. It's meant to be comfortable like a home, but it's not your home. In the 1970s, she went and did a speech at Yale University, and the dean at the time was Florence Wald. Well, Florence Wald was so moved by Cicely's speech that she retired from being the dean at Yale University and started coming up with her own act to how can we make hospice work in the United States. So in 1974, her and 2 physicians and a chaplain started their first hospice in Branford, Connecticut. And this was the first one in the United States. So Florence Wald is the founder of hospice in the United States for us. Lastly, I'm going to move on to the utilization of hospice in the United States. Today, there are over 5,000 hospice organizations in the United States. Over 90% of hospice care is done in the home. In 2007, hospice has served over 1.4 million people in the United States. While in the 2000s, elders on hospice care reached almost 50% of people that were dying. That's half, or if over half nowadays, of people who choose hospice care to die on. There are many organizations with hospice. They travel if you live out in the country. They travel to you, and if they are not in your region, they'll find someone who can help you. Most hospices are non-profit or for-profit. I know a lot of them that are non-profit. This meaning that they don't get any help from the government, that they have to figure out their money on their own. Some criteria for being on hospice is that you have to have a life expectancy of under 1 year, and most people that are going to be in hospice are going to have some sort of a terminal disease or terminal cancer. Most hospices will take anyone with any kind of insurance. And even if you don't have insurance, they're going to figure out a way, how can we help you, and how, what works for you to pay us. So they're really lenient on helping you figure out how you're going to be able to pay for this. In February of 2013, they did a study on hospice and about how not very many people know about hospice. People didn't find out about hospice till it was too late. Their loved ones had already spent a long time in the hospital, and they didn't find out till about a week before they died. So we figured out now this past spring that hospice really isn't something that a lot of people do know about, that we need to get that hospice needs to be brought up more to people, that there's another option besides spending the last few months in the hospital. With this study, they found out that twice as many people are using hospice than they were a decade ago. So if you think about, we're in 2013 now, a decade from now, we could be up to 4 times more people using hospice instead of dying in a home. I think that's a great thing. I feel that everyone should get to die where they want to die, that you don't have to die in a nursing home or in assisted living or in a hospital, that you can die somewhere comfortable in some place that you feel comfortable. So you've now been informed about what hospice is. First, I talked to you about what is hospice. Secondly, we talked about the history of hospice. And finally, I discussed the utilization of hospice in the United States. In conclusion, remember, you always have another option to die somewhere that you feel comfortable.